Let's start our 9 o'clock
Thanks,
hour with a deeper dive into our coronavirus numbers. Renee takes care of that for us every day around this time. Hello, Renee.
Hey, yeah, we've got kind of interesting numbers today. A really high death number that we have seen a little bit of recently, and then lower numbers in terms of the number of new cases that have been reported. So if we can take this up full for you, let me give you a good look at this. We've got 2,938 new cases being reported over the last 24-hour period. But a bigger number is that death number, 238 deaths being reported. And I haven't heard anything from the state yet exactly what those are attributed to. So as of this point, these are the last 24 hours reporting. Also, 9,814 new tests. That's a relatively low number compared to the ones that we've seen for testing lately. But I want to get back to that death number because, you know, for some people that is definitely alarming. What I want to show you is the breakdown of deaths by the date. You can see that definitely that has increased between November and January and after the holidays have hit. And this was a concern for, practitioners and healthcare professionals. But I also want to direct you to the idea that the demographics really haven't changed. So we're still looking at, the age group of 65 and over being the most impacted and those with pre-existing conditions. I also want to show you something else. So that R0 number we used to look at, their reporting has changed, and now they're reporting things that look like this. So what you're seeing here is the 7-day average of deaths, the change all across the country. So your lower left-hand corner here, you're looking at Arizona, and they're showing a 9% decrease, which is basically no change that they say, you got to kind of reach some bigger numbers before they say it's falling or increasing. So right now they consider that there's no real change in terms of the death number as far as the averages for the last 7 days. Also looking at the change in the 7-day average of cases right here. And now this is a better number to look at because we look at here where it's saying that we are in fact falling, and that's by 30%. So good numbers there that we're looking at. I also want to show you this because we have inched down in that percent positivity. For this week, we're hitting 14%, and now last week reporting at 16%. So some relatively decent numbers to report to you there. Celeste?